Hello Ayushi. Today we are going to perform a procedure of digital tonometry which gives a gross assessment of the intraocular pressure in your eye. This procedure is going to be non-invasive as well as it is not going to be painful. We are just going to indent our fingers on your eyes and we are going to assess the intraocular pressure. Either it is very high in your eye or it is very low or it is in a normal range. Okay, for this you just have to cooperate with us that you have to put your face up and your eyes in a down position. Okay, in any case you feel any pain or any discomfort, you can let us know. Okay, do you consent for the procedure?
Yes.
We are going to uplift the chin and we are going to ask the patient to look downwards. Sanitize your hands first. Note that your nails are completely clipped. You do have to indent the pulp of your fingers and not your nails on the eyes. I'm going to indent the fingers on the eye in the downside position. One finger is going to indent and the other finger, which is placed 1 centimeter apart, is going to feel the thrust of the eye. Then I'm going to perform the same procedure with the other finger and the first finger is going to note the upthrust on the eye. And likewise a sinusoidal movement will be noted to assess the intraocular pressure. Similar procedure is going to be performed on this eye also and we can compare the pressure in both the eyes. Now the interpretation will lie whether the eye is completely soft or it is very soft or it is within the normal range or within a between range or it is hard or very hard. This can give us an assessment, a gross assessment of the intraocular pressure but not the exact values.
Consent for digital tonometry has been explained and taken from the patient. Before the procedure, we have to make sure that the nails are clipped and hands are sanitized. They will be asked to keep their chin up and look downwards. Assessment will be done with the pulp of index fingers. Distance between both the fingers will be about 1 centimeter. First we'll indent the pulp of first finger and the other finger will be used for palpating the thrust. Then we'll indent the other finger and first one will palpate the thrust. In this sinusoidal pattern, the pressure will be assessed. Likewise, same will be done in the other eye also. And we'll compare the intraocular pressure of both eyes, and the interpretation made can be assessed as soft, very soft, hard, very hard, and in between. Soft and very soft will be considered as low intraocular pressures. Hard and very hard will be considered as comparatively high intraocular pressures, and the normal range will be either mildly low, mildly high, or normal. For digital tonometry has been explained and taken from the patient. Before the procedure, we have to make sure that our nails are clipped and our hands are sanitized. We have to ask the patient to keep their chin up and eyes down. We will be palpating with the pulp of two index fingers. The distance between two fingers will be about 1 centimeter. First we will indent the first finger and palpate the thrust with the other finger. Then we will be indenting the other finger and palpate the thrust with the first one. Same procedure will be performed in other eye and we will be assessing the intraocular pressure with this sinusoidal movement of our fingers. We will be interpreting the intraocular pressure by comparing the intraocular pressure in both eyes as very soft, soft, hard, very hard, or in between. Soft and very soft, you can interpret the pressure as low. In hard and very hard, the pressure can be interpreted as high. And in between, the pressure can be interpreted as mildly low, mildly high, or normal range.